Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome to the Consult Before the Cut. I am Brittany DeSherry, CEO over at Rejuvime Medical, and I've got with me, obviously, Dr. Jonathan Weiler.
Yes, Dr. Jonathan Weiler, board-certified plastic surgeon, going on 16, 17 years of experience, founder of Weiler Plastic Surgery Group and Rejuvime Medical. And to my right,
Taylor Besh, physician's assistant, expert injector at Weiler Plastic Surgery.
all right.
And we are excited to have Mr. Sean Witt with us today. Sean, tell us a little bit about you.
Hi, I'm Sean Witt. I'm a medical esthetician at Weiler Plastic Surgery. I've been here for almost 7 years now.
Has it been 7 years?
Almost.
Wow.
Just a few months short of it.
You were practicing long before
how long
then.
you
I
been an
was. I was
esthetician
in the
for?
industry about 7 years prior to that.
Right.
So I've been practicing for a total of 14, almost
15
15
years. Wow.
years.
All right.
And you've been on the podcast before with this, correct?
I have not. This
You
is my
not?
first time.
This is his first
Is it
time.
You're going to become a regular, Sean.
Yeah, it's awesome.
Well, obviously, so we've got Sean here with us today because we are going to get into non-surgical hair restoration,
Correct.
which I think everyone is very curious about this topic.
Yes.
Because
Male
I feel like
and female.
Yeah.
male and female, because I feel like everyone throughout their life goes through something where it's hair related.
We brought Sean on today because obviously he's the expert in the field of the device that we'll be talking about, but as a patient perspective as well,
Right.
Dr. Weiler and Sean both have gone through and are going through a hair journey. So wanted to bring him in to kind of pick his brain as well.
Yeah, we're going to sort of focus in on Keralase and lasers in the second half, focusing on what we have and what Sean works with. But yeah, Sean's an expert. Obviously, myself, a man that most men have to struggle a little bit with hair. There's a lucky few out there that I'm very jealous of. You see them on TV.
He's got that good, good
How
hair.
do they do that? You
Like
know?
presidential hair,
I
I feel
know,
like. It's just
that crazy?
maybe not currently, but
So as a male that struggles with what are we trying to achieve? More hair, thicker hair?
So
what?
to me, and it's so a lot of men. So I think men primarily fall into one of two categories. Either you're dealing with like massive, severe hair loss, which can occur with men and women, or you are possibly have fought the hair loss early, gotten on medication to help prevent it, and maybe even done things. But then you're sort of fighting with hair density at that point, right? So you're either sort of a newbie that's saying, hey, I've got these hair loss issues, or you're sort of someone that's been around and been fighting it and saying, hey, how can I get that extra mile to get the increased hair density? And I don't know if you agree with that, Sean, but
I do. My hair loss started probably in my 30s, and I tried all the topical treatments that you can try and got some improvement from that.
Right.
But the thing about those topical treatments is the moment that you stop, then you're going to lose your hair
What
again.
you grew back.
About 40% if you're using
Oh, wow.
minoxidil.
Oh, wow. Okay.
Yeah. So, and I tried going on and off of it, and it just was a vicious cycle. And, eventually, we get to like real solutions.
Right.
So,
right. And I think you're absolutely right. So, there are more aggressive solutions, I'd say, like Sean talked about, or real solutions. There's medications, and really hair loss affects men and women, you get into menopause, some ladies with all the weight loss that's going on with these GLP-1 medications, Ozempic and tirzepatides and Mounjaros,
Before you keep going, I want to talk about reasons why.
Yeah.
Why do we have? Where does
great.
hair loss come from?
All right. So my opinion on this.
Sometimes it's genetics, and you can't fight it.
And you can't.
genetics.
It is what it is.
All right. So a lot of it is, especially male pattern baldness, is genetics. You inherit that. It's coming. You can't stop it, or you can only hope to control it. Right.
Yeah.
So that's sort of one. Two is I put it into the natural aging sort of process that men and women go through. So
So
hair
are you
gets
involving hormones in the natural aging process?
thinner. Hormones, age, weight loss, changes in life, stress, and
Stress.
and that is different, I would say, than disease. There is disease that causes alopecia or complete hair loss. And those can be various types of disease. And you could really even throw maybe stress into the disease category. I had somebody, and I don't know how true this is, but went through a tremendous amount of stress. And they went completely bald. Like I'm talking eyebrows and eyelashes.
Oh, wow.
Now, it may have been a ruse to get out of prison. I'm not sure.
Excuse me?
It's a little bit. So a sympathy play. It's sort of a shady
The way
person.
that strort story went, I was just like, oh, this poor individual that is having this much stress to get out of prison.
Yeah,
I get it.
Did
Prison
it
can be
work?
stressful.
Yeah, did it work?
get it.
That's what we were
It
here
did
for.
work. Got a lot of sympathy and ended up just
We
not
definitely
in
don't
prison.
want our
Wow.
criminals to
So-
be stressed.
and-
Listen, absolutely not.
But I
Josh will
found
not
it
be
weird
stressful.
because this is a person that I intermittently see. I saw this. I hadn't seen this. I know they went through all these legal issues, and I somehow very oddly ended up in a cab ride with this person. And the first thing they pulled out after we started talking was the picture of all the hair loss, like no eyebrows, no eyelashes.
Did it grow back?
It did grow back because they're sitting there with a full head of hair.
Because he's
I
not
was
stressed.
like-
Okay, I'm
about
sorry,
being
they were
in jail
plucking it out.
anymore.
They were plucking it out.
Yes.
OCD.
Bizarre.
Oh my gosh.
I have a bizarre. my life is very normal, but I have these.
Oh,
little
the
spurts of
stories of-
bizarreness. I get myself in a very
The
bizarre
most
situation.
random one's like, well,
Well,
let me just tell you about this guy that I knew that plucked all of his hair out to get out of jail.
So
Genetics,
anyway.
hormones,
Genetics, hormones.
Yes.
stress.
I will say, like, I lost, like, to where it was really bad. After I had both my kids,
Yep.
like, my hair had, and God bless, I started taking, like, vitamins and all kind of stuff, but it had receded so back. I mean, so far back on, like, both sides and all in the crown of my head and back down here. I mean, gobs of hair were
Yeah.
just falling out.
Yeah.
Right.
And I was like, oh, God, like,
Right.
you've got to stop this.
Diet. How does diet make sense? Does it make sense?
If you lose a lot of weight, you lose
Yeah.
your protein intake.
Okay, yeah.
Yeah.
Hair is protein, so
Yeah.
you lose a lot of the hair growth, falls out.
Malnourished, yeah, like you can-
malnourished is very common. That patients are look, obesity is bad. But some patients go to the extreme and they're not taking enough protein in when they start losing this weight. And so you do have to keep your protein levels up and stay healthy and your hair will grow. But a lot of people do suffer with hair loss, with weight loss.
And
So
a lot of
trending-
people also
go ahead.
lost hair when COVID was happening.
Oh yeah.
You're
When they
right.
had
Yeah.
like
Yeah.
long-term COVID.
Yep.
I
Yeah.
know
Yeah.
I lost some of my hair during that time. And I've had lots of patients who lost hair during that time as well.
Wow. So going back to GLP-1s that you were saying earlier, if you're on a GLP-1 but you maintain your protein intake, can you fight hair loss?
Absolutely. No,
Yeah.
you don't lose hair because you're losing
Okay.
weight.
Oh, okay.
You have to be very careful when you lose weight that you're maintaining enough protein to maintain your muscle mass. So you have to work out. You have to lose weight the healthy way. And just because you're eating less, it means you're eating less. So you have to improve your diet, which means more protein, more hydration with that, right?
Yeah, you can't eat less and just
Right.
like
You just like
French fries.
Exactly.
You're
You
gonna
get,
have to like.
I'm losing weight because I'm eating less king cake these days. I mean, you're gonna lose your hair. King cake is not gonna help grow your hair.
I mean, we're gonna be skinny after next Tuesday. So
So let's talk about I think this is great, like myths. So I think myths with hair loss is it's not only men.
no,
Women suffer greatly. I think it's hair loss. My hair loss can occur at a young age.
yes,
I've been going. My daughter dances for one of the local basketball teams, high school, and one of the poor boys is already losing his hair.
Wow.
And it's well known. People talk about it. Poor kid. So it can happen at a young age, and then some people are magical and maintain their hair their whole life. So there's a lot of different factors. But I do think there's a lot of myths out there.
Can you shave your head and it comes back thicker?
I wish. I tried that a couple of times. Didn't work.
Not happening. Huh?
Not happening.
I would be shaving that sucker every month.
Right.
No haircuts, just shaving
Right.
that.
shaving it.
Like the chia pet just spreads back up.
it just-
Exactly.
It just
I'll be all
comes
over
right
it.
back up.
Before we get into Keralase, there are so many
So many options, huh?
treatments,
Yeah.
so many options.
Yeah.
So talk about that.
I'll break it. Let me kind of. I love to stratify things, right? Okay, so I'm a big fan of hair transplants. Okay.
Oh, really? Are you?
I am.
Tell us about it.
So personally, have had one. I need more. We'll get into that because I have a density issue. But hair transplants are real. They are very good these days. No old hair plugs of the olds, right? Saturday Night Live, with these giant, like little caterpillars sticking out. Those were horrible.
Yeah, but what is a hair transplant?
That's what I was about to say.
What do you go through?
All right. So hair transplant's usually a one-day procedure.
Okay.
It's done these days. It used to be they would cut a strip of skin with hair out of the back of your back here, and then they would close that up. They would hand it to a bunch of technicians. Those technicians would cut that strip that had thousands of little hairs in it into either groups of 3 to 4, groups of 2, and groups of 1. And then they would draw your hairline here. They numb the scalp, and then those little individual plugs, which are 3 to 4, groups of 2 and groups of 1 to make it look more natural, are inserted. And literally, they do it thousands
It's
of
like
times.
planting thousands of seeds.
Yep, little-
That
little
all
grass
these
worms.
people
How
helping.
you say that? Okay, see, I'm like, you're like, it's a one-day procedure. I'm like, I feel like
all-
that is. I
it's
think
an
that is
all-day
a
procedure.
24-hour.
It is. Well,
day.
the caveat to these transplants is you should absolutely go to someone who does this full time. And it is because it's really about, it's less about, and being a doctor, it's less about the doctor, it's more about your team. Because the doctor does remove in the old school way. Now, these days, they actually have robots where they suction to the back of your head and it cuts out the little robot individual little plugs and sucks them up. And then those little plugs are then given to
Is
your
it
techs.
like little cookie cutters? Or are they really just removing the entire hair follicle with the shaft? Like,
No, they're taking out a little piece of skin too. You have
Yeah,
to have
okay.
that
So it's like a little
Yeah.
cookie cutter.
little cookie cutters. And so they and then the techs come in, and that's really where the talent is. And they have to place those individual plugs back into your hair.
Okay.
Or hairline.
And that's the scarless.
And that's scarless. So the two ways is the scar, where they cut a strip of your scalp out with the hair. The scarless is where they they don't always shave it these days, but cut it close. And then the little robot, like a little round knife, just goes in there, cuts
pretty
each one
amazing.
out.
Well, that's what I was like,
amazing.
this might be like a silly question, but like, what about the hair that you took out?
So the hair, you mean the hair left?
Like, no. You said that they take hair out the back and move it up here. Do you have like?
So if it's the scar, you have a little incision right
You have
there.
an incision in the hair. You can't see
in the
it.
hairline.
And they
Your
just,
hair grows, you
and
pulls
hair
your
will
back
just
together,
grow.
and your hair grows over.
Well, that's what
it.
I was just wondering. Like, does it just grow? Because obviously this might be your growing hair. So it's
Right.
like, does it just grow back over? Where
So Sean's style of hair, he cuts it very short around the sides. I can't do that because I have had the traditional old school
okay.
incision. So I have a little scar back here. It hides well. Almost most men and women, it's a little bit, but most people that have aging or male pattern baldness or baldness because of aging, it's very dense down here. It's that old monk look, right? This stays very, very dense, and this is where you lose it. Now, females and some men do have just pattern everywhere baldness, but that's much more rare.
okay.
And so,
It really is crazy that it's so much hair right here.
is.
And then
It is, and it stays there for a very long time. So, but the standard I'd say these days is the individual unit FUE, which is the individual unit transplant.
That is wild.
It's wild.
It's amazing.
That's
And-
wild. That's amazing.
Yeah, and you'll see them like, how we were talking earlier about people going to Turkey. Turkey's
Yeah.
a very hot center for this. If you're
Definitely.
in Miami and you go through immigration, these always men running through with swollen heads, bloody swollen heads.
Why? Like, I don't know if anybody knows this, but why did Turkey become like the place?
I honestly, I think it's one of those trending things. There are great surgeons in the United States. There are great facilities in the United States. Some of it is just like trends, and probably once you're all in, it still is a little cheaper to go to Turkey.
Okay.
It probably not dramatically that much cheaper.
You still have to fly to Turkey.
Still got to fly to Turkey. Yeah, stay in Turkey. You got to go, and usually, you need more than one transplant.
Well, I was gonna say, a
Yeah.
follow-up.
Usually, 2 or 3 sessions to do it. To go, it depends on how much hair loss you have. But there's some excellent, and I plan on doing a third, and I am going to use somebody here in the United States.
Not going to Turkey.
I'm not going to Turkey. I'm not running through customs with a giant swollen head. And I'm going to get my follow-up care. here.
So would you say it was worth it?
Absolutely. For
Absolutely.
me, absolutely. One of it because my wife loves long-haired rockers, and and she tended to shave
She
it down.
does.
But also, she does love. But I have a big head,
And she loves you too,
she does
Dr.
love me.
Weiler.
I know she loves me too. But I'm not. I don't consider my head. I think some guys look good bald. I'm not an attractive bald person. I don't have the prettiest head, and I like my hair. So I went in the style of trying to preserve. Now I think I have a decent result. I do think that I need more density. I think, I've had 2 individual hair transplants. The first one was okay. The second one was much better. But it is all about your surgeon and really his team, and having that team that does a great job. And you can get wonderful results with hair.
And can you optimize the result? I mean, can you?
Yeah, there's so, and that gets into our second sort of category. So obviously the surgery works really well, and it can be done on men and women. And we're not going to get deep dive into that. Hopefully, after my hair transplant in a few months,
we're going to do a follow-up.
Yeah, we're going to bring in my doc and everything.
Absolutely. Sean, come on back.
But let's be honest, not everybody can afford have the downtime or want to go under a surgical procedure. So that's kind of where we'll shift our
I agree. So there's lots of other alternatives. So we all know about there is an oral pill that you should take as a young man if you know you're going to lose your hair, which can preserve your hair. There can be some sexual side effects to that medication, so it's a little bit controversial. It's rare, but one of the caveats they always say is those side effects could be permanent. All right, so it scares people.
Right.
So a lot of people get scared with that.
That could be,
So, but I do think that's a very safe drug to take as a young man that's faced with a future of possible hair loss.
Yeah.
And a lot of Hollywood stars take that. And so I do think it's a good thing. Now, that sort of hopefully prevents, it doesn't necessarily grow. Now, there's topicals, right, like Sean talked about, out there. And
have either of you said you have used topical, but just the minoxidil?
I'm currently using minoxidil plus a finasteride compound.
Okay.
Yes, and that's what I was going to get into.
And that's one of the newest compounds that they've come out
the newer
with.
thing. So, 15, 20 years ago, you had to go into Walgreens or get a prescription and walk in and get this foam stuff. And it was just a single medication, minoxidil, topical. They didn't really have topical finasteride back then, which was okay, right? And it started out at a lower dose and eventually got higher. And it helps grow. These days, the hot things are the compounded, where you're taking multiple medications and you're mixing them into a single topical application. Hims and Hers does a lot of that.
We have it.
Rejuvime, we do a lot of that compounding stuff. So they're much more available. Compounding pharmacies have gotten very savvy and very sophisticated and excellent. We've realized, just because one medication works well, if you put 2 that work well together, it works really well.
Yeah.
And that's what we've learned.
Yeah.
So you use it, it works. The second you stop it, you feel that you have lost what you achieved.
Well, I learned early on that you just don't stop.
Okay.
Because when I did stop, I did lose it.
Okay.
And it takes about 2 months. And then you look in the mirror and you're like, oh, wow, it really is all gone. And then it takes 3 to 6 months to get it back once you restart.
Right.
And it's a cream that you just put in the scalp?
The one I'm currently using is a spray. It's actually from Hims.
Okay.
And it's the minoxidil with the finasteride. They also offered in a chewable, believe it or not.
Wow.
Really? Yeah. That's new.
Yeah.
But we do think, so obviously a oral finasteride works really well. Topical finasteride with minoxidil works really well, and that's mostly placed topically.
Okay.
Little controversial, and you have to talk to your doc about women, what they can use, depending on premenopausal, postmenopausal, childbirth.
Childbearing years.
Childbearing, these things can be highly toxic to pregnancies. So you have to be very, very careful with that. And they work through a detailed sort of hormonal process that causes a lot. Men with a lot of testosterone lose their hair. Right.
Do they?
They do.
They do.
Thank you, Sean.
They do.
They're like, absolutely. Absolutely, they do. Well,
and then I'll say it happens. So, there's the oral medications and there's the topical medications. And then let's get into like what we're here for, which is sort of like lasers. And then even injectable stuff.
I was about to say, before we get to lasers, let's talk about injectables.
All right. You talk about that.
What did we used to inject in Hammond a very long time ago that was not PRP? Anyway, PRP is one of them. We've moved away from that. It was a injectable ACell.
Yes.
I think there's things that have come and gone on the market that have
there was
not proving efficacy, basically. But PRP Platelet-rich plasma, you draw your blood, spin it down, you take that isolated plasma and you can inject that into the skin. And that's just saying the thought is that the growth factor is going to stimulate that growth phase. You do a ring block on the head and do numerous injections of the scalp. We injected him and it was very uncomfortable.
But not bad. I mean, it's not the most pleasant thing.
Okay. And yielded what results?
I am not, and I don't want to get controversial here. I am not a big fan of PRP in the scalp for hair restoration.
Right.
And I mean, correct me if I'm wrong, but there's no scientific data that backs up that PRP actually causes
Yields
hair
good
growth.
results.
It now you start getting into, so like you said, people need to understand there's a difference between PRP and stem cells, right? Or the precursor to stem cells, which we talk about these days. And so there may be more promise in stem cell injections, but that's a product that is not your own body. You get other people's or other line of stem cells and inject it. So that may have more promise. But like Sean said, there's not a whole lot of data out there.
Yeah,
The
but that's
PRP
also
thing.
an exogenous source and it's a gazillion dollars.
Yeah.
And you can't say it's 100% going to yield the result you want, right?
Right. You can spend, if you're doing stem cell stuff to the injectable scalp, you're getting almost the cost of hair transplant.
A hair transplant, right?
So it just does not make
Might as
sense.
well.
Now, the PRP is your own blood spun down and re-injected in there. There's lots of uses for PRP. I am just not a huge fan of it I think it was very hot. Y'all can talk about that for a while. And I have always said, it's not hurting things, but I don't love it. I don't love it for the scalp. Sean, your thoughts on that?
I don't love it. I've had friends that have spent thousands of dollars locally on PRP injections to the scalp, and it yielded no results.
Right.
What about microneedling to the scalp?
Microneedling, it can be good for the scalp, but you're also, once again, just creating channels and stimulating. You're going to want to put some sort of topical that's going to penetrate deeper whenever you're talking about microneedling. It's just not microneedling alone.
I agree.
Okay, yeah.
Okay, so it's microneedling plus.
It's microneedling plus.
So that's kind of does that lead us into
Well, it
Keralase
does. I think
after
it
that?
does.
Yeah.
It's going to lead
It
us
does.
into light-based energy / lasers,
Right.
and topical, sort of very focused products to apply. So we'll take a little break here, right?
Take a little break and get back into it.
Yeah, we want to thank our sponsors, Weiler Plastic Surgery Group, the largest plastic surgery group in the state of Louisiana. All right, check us out. And Rejuvime Medical, your anti-aging clinic. We specialize in GLP-1s, hormone optimization, and hormone replacement for those that need it. And we do a little bit of aesthetics also. Stay tuned. We'll be right back.
I'm Ashley Shelley. I'm from Baton Rouge, and I've had Sculptra, Botox, and aesthetic procedures at Weiler. I realized that it was time to start taking care of my skin. There were certain concerns that I had, loss of volume in my face and the texture. I knew that I needed to do something about it. Sculptra has boosted my self-esteem and increased my confidence in my skin. I'm 40 years old, and my skin has never looked better than it does now.
My name is Amber. I'm from Denham Springs, Louisiana, and I'm currently on semaglutide. I started my weight loss journey a few years prior and just kind of struggled with getting to that final weight loss goal. I decided to get on semaglutide because I was really working towards those last 20 pounds. Working with Rejuvime is so simple. When you really have that person that's in your corner, they're cheering you on, they want to see you hit those goals. I feel like I'm healthier, I'm at that wonderful weight. I just feel really confident, feel comfortable in my skin.
Welcome back to the Consult Before the Cut. We are going to continue this fantastic conversation regarding hair restoration, and we are going to get into lasers and lights.
Yep. Yeah, I think we're going to focus this second half. We've got Sean here who's got real insight. We're going to focus in on light-based energy devices is what I call them. We'll talk about that really quickly, and then how we can combine that with what we do over with Sean at Weiler. And so I love to talk about light-based energy devices for hair. It's almost kind of comical, and Sean laughs a little bit at me, but these laser caps that you see online, LED lights essentially, and if you follow these guys, if you do a little TikToking and see these transplants in Turkey, the guys always get the LED light before they go home, So light or slash energy helps hair growth, which is crazy, right?
So you think that the hair caps work? The
Oh, I
LED
don't
light
think-
hair cap, they
You're
work?
talking about, I'm sorry.
I mean,
you're
I
talking
do
to me.
think they work to
You
an
will
extent.
find Jonathan Weiler driving his car with a hair cap look around our city.
No, I think
don't
they do
think.
work. Absolutely.
Yeah, they do work.
that
Yes.
light-
They are.
You
it's-
have to be really consistent, though.
Okay.
Yes. You have to be very consistent with it. It's sort of like the topical minoxidils but there is like, if you want to put, there's no doubt that like minoxidils and the finasterides work. You put that, I think you put those laser caps, light-based energy devices, in that category. It's been scientifically proven.
I know, but like, what the heck is it doing?
What is it doing to make it work?
Now you're getting a little deep.
Red light in
It is
itself-
stimulating the growth of
Absolutely.
the
Yeah.
growth cycle.
Yeah.
It's elongating the growth cycle.
It's elongating, thickening the roots.
Yeah.
Right. I mean, red light
Strengthening
therapy
that
is good for a
follicle.
lot of different things. In this particular case, with hair restoration, it's great.
Right.
It's also a great add-on if you're using other topicals as well.
Okay.
Correct. And so the light-based energy can be device. So those laser caps you see now, you can't buy the TikTok shop $20 laser hat.
No.
Yeah.
All right. It's got to be a high energy. You got to look at the wattage and the output, the lumens and all that in it. There's some very reputable places out there that sell them. You're talking about a couple $100.
That's what I was going to say. What are we looking at?
You're looking at,
investment-wise?
at least four. I mean, I'm on $400 to $500 probably minimum to get
Okay.
into a good laser cap.
10 minutes a day.
Yeah.
10 minutes
Yield
a day.
some results.
Carafactor offers their own laser.
I mean,
Oh, did they?
Oh,
They
does
do.
it?
Yeah,
Okay.
Throw
the
that
red
on while
light
you're, like,
to
brushing your
use in
teeth.
addition with your treatments if you want to. I think it's around 900.
Yep, that's appropriate.
Okay.
Yeah, they're complex devices. They put out a lot of energy, which is light. Light to me is energy, and what they're doing, and I believe, is they are thickening the hair follicle. They're lengthening the growth cycles, and they're increasing your density of your hair. And you can do it with a hair cap. There are esthetician or lasers that. We'll talk about ours that we have, but there are like red light devices. You can go into a spa and have a red light, treatment to your hair that is effective also. The problem with those milder or less strong devices like the caps is the consistency. You have to use them all the time.
All the time.
All the time.
But these lasers you can have at home.
The
The cap. I'm sorry.
So remember that. No, but you're right. Lasers is light, right?
Uh-huh.
And so-
Right. Laser.
And so, red light, LED, it's light. It's a laser. It's just it's not we did an episode about like CO2s and erbium yags,
Yeah.
or like Star Wars lasers. They're all the same thing. It just depends on the strength and their their bandwidth.
Right.
And so the hair caps, they are a form of a laser. They're just a visible spectrum. They're red, most of them, red light therapies. They get a little warm. They don't hurt, but they're putting enough energy into your scalp where you're seeing the results.
So is that the exact same thing as the red light masks that people are wearing?
Probably different level.
Okay.
But
Yes.
yes.
Okay.
Okay.
Sean's exactly right. Different levels. So the problem with is that, most consumer or lower quality things don't have enough power to make a difference. And then like, it's got to be a device that doesn't burn your skin. And so those are all considerations. So yeah, if you go and you have the ability to get like this nice red light mask that like you can lay there and it pulls it and you do it every day, it'd be very helpful. But that's not going to be cheap. It's not going to be $40.
But I guess the thing is the consistency and the one and done. I mean, who has 10 minutes every single day to wear a cap? He doesn't do it. He's non-compliant because he's a busy surgeon. Like most people are not going to do that every single day.
Tell
But
us,
you
call me
could
out.
do that. I know. It's just like, I like it too. It's just
Seriously,
like,
so
I'm gonna
that's
throw
where I
him
think
right under the bus.
Keralase fits in.
Right.
That you come in, you have the procedure.
Well,
Right?
so there's more powerful lasers that you don't have to use every single day, right? And we've got, and I'll let Sean talk about it a little bit, but the system we use at Weiler, I think, is very effective, right?
It absolutely is. I've
Yeah.
gone through it myself.
So what is this treatment that you have at Weiler that is effective?
The treatment is called Keralase. It combines Carafactor products with Ultralase MD laser. The laser is a 1927 thulium laser, so it's attracted to water.
There we go.
So,
The 1927. What did you say?
1927.
I like it.
Yeah,
It's
but
awesome.
I do like
it's
that
a
it
single.
said-
It's picking out that
that's it.
1927, which is
That
awesome.
1927, but like you said, explain a little further. It's going to water.
It's going to water in the scalp. So it's not attracted immediately to pigment. So that's why we're not burning hair. You know, we're creating those microchannels in the scalp to allow the ampule, which is growth factors, peptides, to penetrate deeper.
Okay.
And the laser stimulates the follicles and really creates the perfect
Delivery
for the actual product.
So you're using the laser and putting the ampule on at the same time.
No, we are not. We create those microchannels first because when a patient comes in, they do have to have clean, dry, product-free hair. So their hair can't be wet or oily or anything like that. So we create the microchannels first and then immediately apply the ampule after.
So what is this ampule? Is it just like a serum type
That's
thing?
the Keralase
That's
serum.
the Keralase.
That is the
Care
Care
factor. Does it matter? Does hair color matter? But I know how you said not pigment, but like, does hair color, does some grow more than?
You mean natural hair color, or does it affect hair
natural
color?
hair color?
No, it doesn't.
It doesn't.
This is a colorblind laser. We can do this on any skin type.
So it's for anybody.
It's for
black hair, blonde hair,
anyone.
white hair.
Absolutely.
Good to go. Okay.
So Sean, so let's take it back a step back. Who is a good candidate for this system, you feel like?
A good candidate, I mean, it can be man or woman. This treatment's for everyone. But someone who is losing hair but isn't completely bald, we can treat areas that are thinning. We can treat all over, but it's not going to grow hair back in an area that's completely slick.
Right. And that's where we say, you know, if you are beyond the point of these let's call them, you know, non-surgical alternatives. If you are, have that bald head, and you have that rib of hair, your only alternative is to go and get a hair transplant, right? And that's where I think a lot of people get duped that, you know, oh, hey, let's do PRP into your bald head. And
It's not
No,
going to
you're too far gone.
right.
No, you're too far gone.
And I think that's an important distinction.
Yeah.
Yeah. And really the only people that we aren't going to treat is someone who suffers from like autoimmune disorders and things like that, because that's something that we can't control. That's something inside the body.
Right.
That's attacking the hair follicle. Yeah.
Absolutely. But it's a great treatment. I mean, we recommend 6 treatments. It's a comfortable treatment. It's not painful at all. And we just make these tiny parts like through the hair and then apply the ampule after.
So you walk in and obviously clean hair, right?
Absolutely.
No products applied. Talk us through the process of the laser, how it feels, and I'm happy to speak with it too. But from your side, talk about how it, you know, you doing the procedure.
Right. I mean, there's kind of like a tiny pinch to the laser, but it's not uncomfortable at all. It almost feels just like a tingling sensation.
Right.
And we're making these pencil thin parts. I almost feel like a hairdresser some days trying to make all these tiny little parts in hair. But it's comfortable. It's not uncomfortable. Afterward, there's not really a whole lot of aftercare either. You just can't shampoo for 24 hours and you have to stay out of the sun. Staying out of the sun for 5 days is essential to the treatment.
Yeah.
How long does the treatment take? Like, how long would you say that I would be in the office for? Or does it depend on, like, are you treating my whole head or just a part? Or
It depends on where the treatment problem is. Okay. If I'm treating whole head, it's probably going to take me about an hour and 15 minutes.
Okay.
If I'm treating just the crown, where most people treat, because that's where the majority of the problems are, then it's going to take about 30 to 45.
Okay.
And her hair versus his hair, I mean, it would take longer
Well,
doing your hair.
Her head versus my head.
Yeah, that's
Got a
right.
big head.
Yeah, he has.
Not necessarily.
No?
You'd be
Okay.
surprised because his
Wait,
hair
I got
is
a big
short,
noggin.
so it's kind of hard to keep it out of the
Yeah.
way.
Oh,
while you're
got it.
getting the
I think
Okay.
shorter.
Oh,
Yeah.
wow.
And
So you could
her
just, like,
hair's
part it.
long, so you can
yeah.
make that clean
Sean's
part a
always-
lot easier.
When I am compliant, he's always struggling to get the part
yeah.
going because
I
my
would
hair.
not
Yeah.
am compliant,
So
which is
how-
not often, so you don't have
6
to worry about it.
sessions.
6 sessions is the recommendation.
How far apart?
4 weeks apart.
Okay.
Okay.
So I have a question. So
Yeah.
pretend like he really is going to do his hair transplant coming up.
I am.
Should he
I've already done 2.
Keralase like that part to strengthen where there's already product? I mean, there's already
Already hair?
hair that's going to be grafted. Does that make sense?
Like, you talking about like thicken it up so
I
it's
don't
got more to choose
think
from?
it's necessary. His hair's really thick there.
Yeah.
So
I
he would
don't
be the
think-
best with Keralase.
But he absolutely
here.
could
Yes.
come back once his hair transplant is healed,
Post treatment.
and we could do it.
Right.
The treatment then, and he could add
Right.
more density to his hair
Yeah.
that way.
Okay.
Right. Like think of it as like so whoever I go to, they're going to be planting
Seeds.
the seeds, right? The plants, and then
He's
I'm
watering
going,
it.
I'm going to the gardener.
There you go.
Right? He's going to take care of them. He's going to water them. He's going to take.
Fertilize.
Fertilize
Let those
it.
little plants grow.
And that's really what like the Keralase system is. It's fertilizer, in my opinion. With the tools of the
I do
laser.
have a question. So once you start seeing the hair grow back and stuff like that, could the hair grow back in a different texture than?
I wouldn't even call it hair growing back. This
Okay.
is new hair that we're
This is just brand new hair.
brand new hair. And you start to see we're basically creating the perfect ground for this hair to grow in the first 3 months.
Okay.
Okay. From 3 to 6 months, that hair's growing. And then in 6 to 9 months, that hair is getting longer and stronger.
Okay.
So it really is a process of time and just
Yeah.
waiting for those good results.
And just getting that healthy soil
Mm-hmm.
up
Absolutely.
there.
I want to flip the switch a little bit. I know
Okay.
you have had Keralase, which, I mean, obviously you believe in it. And how has it changed your hair?
I mean, it's how it's changed my life more
Really?
than anything. Yeah,
Wow.
it's given me the confidence that I didn't have before. I mean, we're on video all the time here,
Yeah.
having to shoot. You don't want to see a bald spot.
Yeah.
And I had, that
Right.
crown that was really, really thin. And I did the first 3 treatments. I was not going to look in the mirror because you look every day and you don't see those changes. So I deliberately waited 3 months. And when I saw the difference, I was amazed.
We need to put
The before and after
pictures.
pictures
Your pictures
Yeah.
are
are
amazing.
great.
It's so good.
Yeah.
I mean, it
And
really is.
For those of you that are watching, Dr. Weiler has been non-compliant. So I do not like to watch myself. Only had 2 treatments. It's been a couple of months. So don't judge the system by
couple
by
of
these
He is a
results.
very busy surgeon.
Everyone could
Many
just,
months. I'm sorry.
It's been many months.
It's like everyone just don't look. But here on Sean's
We're going to
head,
hold him in the chair next
do
week
it.
and
Sean
do
is the
Keralase and
model.
Botox.
Sean is the model patient.
Keralase
I've
and
offered
like,
to
I-
come in
I've-
on
I've
Saturday
had-
to do his hair.
I really have had a ton of patients, men, come in and like unsolicited, like, oh my goodness, it's awesome. Like
Keralase?
Keralase.
Amazing.
A
It's
bunch of
incredible.
men. A
That's
bunch of men.
amazing.
It really is. I think you put the time in, and if you're looking for a really definitive, good alternative, not wanting or not really needing the hair transplant, it's a great system.
Yeah.
It really is.
And
And
another,
I think he's being a little non-compliant because he knows he's
Yes.
about to do the hair
Yes.
transplant.
Exactly.
So Keralase
Yes.
will be
yeah.
hyped
When I
up
put that
after.
money invested in that
Exactly.
hair, that decent hair, I'm
Right.
a little more compliant.
and another great thing about the Kerafactor products and the ampule that we're doing, it's minoxidil free. So when you're finished with your series, you can continue with the products, but you don't have to. And
I
you're
was going to
not
ask that. Can you
okay.
combine?
Okay.
and you're not going to experience that 40% hair loss like most people would do when they stop minoxidil.
Got it.
Okay.
Are they going home with ampules or you're just applying that
No,
topically?
I apply the golden liquid in the office.
your
But
stuff.
there are products to use during this product. During this
The
process.
process.
During the process,
Mhm. There's a shampoo conditioner. There's also a scalp stimulating brush that comes with it. And
The serum, right?
a serum, an
which is awesome.
activator serum that is for trouble spots.
Okay.
Okay.
But no redness, pain
There
issues
is
after?
a little redness on the day of treatment.
Okay.
Right.
Okay. And there is warmth
Right.
on the day of treatment.
And you do have to stay be careful with your hair with the
I was
sun.
about to say,
Yeah.
is
Yeah.
this like
you don't, us guys with thin tops, you get
get
sunburned up there
sunburned.
You
pretty
get
quick.
sunburned really easily.
Yes, you get to be careful. Hat.
Price point.
Yeah.
Price point, our series of 6 is $4,000. A great thing about Weiler Plastic Surgery is we do offer a maintenance plan because you're going to want to come in 1 to 2 times a year to
Yep.
do that
Okay.
treatment to keep things going. I just did my maintenance treatment last week. It'd been probably about 9 months since my last treatment. And we offer that for like $350.
Oh, wow.
So
Yeah. Oh, that's
we
good.
really
Yeah.
are encouraging you to come back and keep
It's kind
up
of like
with
laser hair removal. Like you're going to do your 6 to 8 in the beginning, but then you need to maintain. every-
Absolutely.
Okay.
Right.
it's never done?
Right. And I think, look, I think hair is, there's a lot of, obviously it's like a hot topic, and you always see stuff on social media, at least I do, because I'm getting fed it, but you see
Right,
it on
there.
social media, you know, and I think there's a lot of stuff you can waste a lot of money on, I think, unfortunately, out there. And, you know.
And then you lose hope in other.
Exactly.
Yeah.
Exactly.
Modalities.
So, you know, there's a couple very proven modalities that, you know, they're not going to be relatively cheap, but they are going to work. And, you know, and we really want, you know, Sean's personally invested in this too, you know, in terms of, so I think it's a great thing. You know, I think it's a great alternative, and we, you know, we encourage patients to come in and have a dialogue with us. 'Cause,
Yeah.
you know, it's one of those things where there's almost so much information, it's overwhelming. And I think people can get confused or a little bit scammed.
Well, yeah, and I think, you know, it goes back to, we always talk about, you know, we always touch on, like, it's a vulnerable topic.
Yeah.
And so it's like to be able to come and sit down and connect with someone
And
who
men are
can give me that.
men are much worse than women about talking about these kind of things. Much worse. Because you don't necessarily
My
talk to
husband
your,
shaved his head.
yeah, I mean, well, because like, you know,
Just-
you don't talk to necessarily your friends or your buddies about some of these more, like females are a little bit more, it's just in tuned with it.
Y'all don't have a group text about your changing bodies. Like, y'all don't have.
No,
like-
it's more taboo. So it is tougher, I think, for
I
guys.
have a friend at the basketball gym, 2 weeks ago. He's like, Taylor, I need to speak to you in private. And I'm like, and he's a male.
Right.
And he's like, I am losing my hair. I need you to help me. And he saw Sean last week, and he's like, I have been battling this for 2
Yeah.
years, and now I finally have like hope that there's
Yeah.
a solution. So
Yeah.
that's good.
It's good. All this stuff is feel good stuff.
That's
It
right.
is.
Yep.
It is.
It's such a fun journey.
What would you tell somebody navigating hair loss, a male specifically? Where do they start? Give me some guidelines.
I mean, you can always come in and talk to us. I
Yeah.
mean, your consult doesn't cost anything to talk to me. We find out if you're a good candidate for it. You know, it depends on, you know, what your budget is. I mean, you can spend a lot of money on hair restoration. Some people have it and some people don't. Some people are going to start off with Nutrafol or something like that. You know, and those are options. And I think that they do provide some results.
Some improvement, yep.
It's not going to be the results that you see with
Right.
the Keralase treatment.
Right. Yeah, I think our goals are, like you said, you know, come in, talk to Sean. I'm always happy to talk about it too. It's my little personal journey.
I think y'all are both so passionate because you're going through it.
Yeah.
Right.
Oh,
Right.
absolutely.
Yeah.
It makes
Yeah.
all the difference
Yeah.
in the world.
But we're gonna, give you. You know, we don't do it all. We don't do hair transplants here. So happy to refer. Happy to give you advice. We do some things very well. Happy to talk about the medications. Happy to refer over to Rejuvime for some of
I
those.
was going to say, a lot of our nurse
medications.
practitioners,
excellent
they
at it.
deal with a lot of that stuff. We also have, like you were saying, those compounded medications that
Yep.
these guys are really like doing. We have women that are using, different types. So they have all kinds of.
Yeah, you do need,
all
for
kinds
those
of
prescription meds, you do need a little bit of
Yes.
medical guidance to make sure there's no, especially women, make sure there's no contraindications. But yeah, come and speak with either one of the providers at Weiler, me or Sean, or over at Rejuvime. All of our ladies talk about it, but just gather a little bit of information and go. Like Sean said, everybody has a different budget, and
Absolutely.
there's things that you can do very, very low price that can make a difference. And
Yeah, I mean, I started off with, the $26 can of Rogaine.
yeah.
And now I'm been able to do the Care Factor treatments. I mean, it's changed my life.
Yeah.
I love that.
And I think people kind of take a step back because it's overwhelming because there's so much.
So
Yes.
much information.
There is.
So you need guidance.
And for
So
the love
I
of
hope
Pete,
this
don't
provided
TikTok
a
it
lot.
because you're
Yeah,
going to get,
Yeah.
you know.
don't TikTok.
Then all you'll
take-
get is like me. All you get is
that's it.
guys flying over from Turkey.
It's just videos of that.
Nothing on TikTok shop, guys.
But it's like, but also be aware of the, Dr. Weiler driving on the roads.
You
with
see
cats
me
and
wearing
stuff.
glowing red. Middle of the night, I have my laser cap on.
I mean, there's a lot of things out there. Do your research.
Yep.
Yeah.
Don't fall scam to some of these crazy things that are on the market. I'll be the first one to say Keralase definitely works.
Yep.
It just has to be on the right candidate for treatment.
Yeah.
Yeah.
Awesome.
Awesome. All right. Well, Sean, thank you so much for joining us today, sharing
course.
not only your expertise, but your journey. Oh, well. And Dr. Weiler, thank you for sharing yours. If you would just become more compliant. I feel like, no. No, thanks everybody for tuning in. Be sure to follow us on Instagram and TikTok. We are at The Consult Podcast. We are on all the streaming, streaming services.
Below, right?
Subscribe to our YouTube channel, all the fun stuff. This is Taylor and I's retirement situation. So,
retired too.
I was like, so if
Did
y'all
you
could
see his
support
face?
us-
He's like, what?
I was like, so if y'all could support us, that'd be great. But like, thank y'all so much for tuning in. Remember, stay curious, stay informed, and always consult before you cut.
Absolutely. Thank you, guys.